surgery.
I have a lot of reservations about doing this procedure. She's 13.
Why desperate parents are crossing the border with their overweight teens for this operation.
I have to help her.
Then, the whole family had lap band surgery and lost this. What they look like now. And
take a look at this picture. Stephanie is your typical 13-year-old girl. She doesn't even look obese, but she weighs nearly 240 pounds. Just 2 days ago, she crossed the border to Mexico and underwent gastric lap band surgery because it's not even approved for minors here in the U.S. You know, as you can see right here with the laparoscopic camera, the surgeon is tying off the stomach of this 13-year-old girl. Stephanie is here today, and we'll talk to her as well as her mom a little bit later about why she went to such extremes at such a young age. We'll also meet the doctor who performed her operation. He says he has no problem operating on teens, but teens and lap band surgery, you know, right now in America, only teens over the age of 18 can get this procedure done. This is another way to lose weight. We talked about manorexia, people trying to lose weight the wrong way. Is lap band surgery the right way? And Drew, do you want to even tell us what lap band surgery is?
Sure, I'd love to. You know, it's a very common procedure now. It's typically done laparoscopically, meaning through a small incision with a tube-like instrument where you actually go in and you put a band around the junction of the esophagus and the head of the stomach. And what that does is just less food is allowed to enter into your stomach. So you have to eat less and you have to eat more slowly. And what that does, over time, you definitely will lose weight.
Is it safe for teens?
That's the big question, because it's going to take a while for the FDA to look at the data and to have enough teens have this done so they can see if it's safe or not. And that's the problem, because I personally think it is. It's much safer than some of the alternatives, which is not doing it for one thing, because then you're guaranteed you're going to get diabetes and heart disease, all that kind of stuff.
That's exactly where I'm at. I mean, there's reasons why it's 18 now with the FDA, but at the same time, it's such a huge problem. As a teenager, the toughest years of your life, if you're fighting that weight problem, I mean, it can affect you for the rest of your life.
I decided that the best option for Stephanie is to have lap band surgery. I don't want her to go through high school handicapped. Hello.
Hey, Stephanie. Nervous?
Yeah.
Don't be. You're going to be asleep. We're doing the surgery.
Bye-bye, baby.
I started performing this procedure soon after I was trained by the gentleman that devised the implant. To date, we've performed 115 gastric banding procedures on teenage patients. Now we're going to start. So what we're doing now is creating a tunnel behind the stomach. Now we're going to grab a hold of the tubing that connects the band, and we're going to pass it through. Thread it again until this latch closes and the band closes onto itself. This is her new stomach. The width of the tip of this instrument is around 2 centimeters. This area is her new stomach. This would be her old stomach. Nothing has been changed. The only thing we're doing is we're mildly squeezing this area so the sensation of fullness is attained faster.
I'm a little bit nervous, but it will be all fine. It will be all fine.
The surgery is done. We've completed the surgery in less than 10 minutes. It's a very quick, straightforward procedure. Band is in a perfect position, and she did just like we expected.
Thank you so much.
Dr. Ariel Ortiz, he's the director of bariatric surgery at the Obesity Control Center in Tijuana, Mexico, performed Stephanie's surgery. Stephanie's mother, Tanya, is here with us as well about doing this procedure. She's 13, and to me, you know, in a very morbidly obese person, it's a great option, but it's not approved by the FDA here in this country. So you take your patients to Mexico to do this.
So what has happened is we started off 7 years ago, and it so happens that we pioneered the procedure, but not only that, it started catching on in the United States. I had the fortune of training a pediatric surgeon that started this also in the United States, in Florida, and he's done 230 cases now. And we compared notes, and we're now preparing for the literature the results. We're seeing teenagers are having better results than adults.
But a lot of people, again, you're going to Tijuana, Mexico. People are wondering, where did you do your training?
I did most of my training in Mexico and some of the training in the U.S.
And so med school was?
Med school was in Mexico, surgery was in Mexico, then I did rotations in the U.S., and we started training the first U.S. surgeons doing this around the United States.
You know, this procedure helps teens lose weight.
Wonderful. There's a couple of things that Stephanie's very unique. She's a very tall 13-year-old, number one. Most of our 13-year-olds are as tall as we are. Right. Number two, she wears her obesity very well, but half of her, 50% of her body weight is fat. That's as sick as it gets.
So you tested that?
Of course. We do every type of testing. She also has severe restriction, pulmonary restriction, because of the body fat that she's carrying around. What does that translate? That translates as she gains more weight. That's even going to create more problems to exercise and to do the conventional treatment. So what happens is the difference is, I tell my patients very simply, we don't fiddle around with God's architecture, we just squeeze it. So what we're doing here is we have a stomach. The only thing we're doing is we're mildly creating two things: a new inlet for food, and number two, we mildly adjust this, so we kind of create an hourglass situation where this upper pouch is now the one that feels full, where you reach satiety, and the other one stays the same. But as you can see, the physiology, the function of the stomach has not changed. It's just a regulating outlet.
So it's really, this is what's causing you to feel full instead of all of that.
It's been considered as a satiety-inducing device. The stomach doesn't know if it's full from the bottom to the top or from the band to the top, so satiety is reached a lot sooner.
And this is as an alternative to gastric bypass, which is a little bit more invasive. We do have an animation of that because you're not doing gastric bypass on teenagers, correct? Which is not really reversible. You're basically bypassing the majority of the stomach. You staple it off, and you know, one of the realities of that procedure is you can have vitamin deficiencies and whatnot. So this is a more simple procedure, and it is reversible. But I want everyone to walk over here because, Stephanie, I'm going to ask you some questions about if you're ready to make some major food choice changes, okay?
Yeah. We want to hear how you feel about all this now that you've done it.
So let's come on over. We're going to ask you about that over here. So come on over here. A lot of major changes ahead. Are you excited?
Yes.
So you're ready for this? So are you ready?
I am.
Okay. And Dr. Ortiz, is this a difficult adjustment for your patients?
Initially, it is, but what's going to happen is that there's a couple of things that are going to happen. As she loses weight, she's going to learn how to chew better, how to make better selections, and she's actually going to end up eating a third of the first plate, around a third. And around a third is, right now she eats this much, she's that weight. Going down to a third of her typical intake will take her that much down.
Well, we certainly wish you the best of luck, okay? And thank you for coming on, Dr. Ortiz.
You know, as a final note, do you feel comfortable doing it? It seems to be work. Do you think that we're going to change the way we look at it here in the States?
I can definitely say that the results are not only promising in our trials, the results, the initial results that have been published in the U.S. are now saying exactly the same. It is a wonderful, very safe, very effective procedure for teenagers.
Well, for more information on the pros and the cons of lap band surgery, visit our website at thedoctorstv.com.